Hey guys, Dakota Williams here again. Today I'm going to be introducing you to the opioid reversal drug Narcan. It's also known as naloxone, but it's most commonly known as Narcan. This medication is a pure opioid antagonist, and what that means is it blocks all opioid receptors in the body and brain. It is usually instantly administered nasally, if you know anything about that. But if it's administered quick enough, it can completely reverse an overdose from opioids and save someone's life. But before I show you how it works, there's some facts that you need to know before you feel like you're comfortable to administer this drug. Keep in mind, I said it's an opioid antagonist. That means it only works against opioids. So if someone is overdosing from something other than opioids, it will not be effective. It has to be an opioid. Now, if you're not privy to what an opioid is usually a painkiller. They're prescribed for anything from headaches to severe cancer patients, things like that. Opioids are usually derived from the poppy plant. Well, they're always derived from the poppy plant. The only exception are those that are created in laboratories. Those are known as synthetic opioids. Some of the most common are hydrocodone, oxycodone, heroin, fentanyl, and morphine. Now, as most of you know, college campuses are quite the hotbed for drug activity. So it's important for you to know that some of these drugs that you may encounter are counterfeit, and they contain fentanyl in them to increase the potency. And the DEA actually has done extensive testing on these pills, and they found that 4 out of 10 of those contain enough for an fatal opioid overdose. So it's pretty dangerous. In 1999, there were about 7,000 overdoses in that year due to opioids. In 2021, there were 80,411. Now that's 11 and a half times as many, and that number just continues to rise. And as you can probably tell from either personal experience or from the data that I've just shared, knowing how to administer this drug is very important, and it is going to continue to get more important as time goes on. So as I previously explained, this is an antagonist, an opioid antagonist, and that means it completely blocks all opioid receptors in the body and the brain. If it's not too late, it may save someone's life. You can almost assuredly find Narcan from the Cabinet of Health and Family Services. If not, contact Morehead State University's Counseling Center because they have staff that are trained in substance abuse disorders, and they'll be able to point you in the right direction. Also, Narcan lasts about 48 months. That's the shelf life. Always keep it stored in a room temperature. Don't freeze it. Don't, store it in a hot place or anything like that. There are multiple types that you will encounter. There's intermuscular that are manual, that you actually take a syringe from a perforated bottle. You won't encounter that very often. That's more emergency medical services do that. There's also instant and automatic intermuscular that are injected into the skin and into the muscle. But the most common type is the nasal spray, and that's what we'll be working with today. This is naloxone. They're designed to be easy to use and administer. If you expect someone is experiencing an overdose, check them for the common signs. They could be unresponsive. They could have slow or labored breathing, blue lips, blue nails, cold or clammy skin. They could be making gurgling noises. And they could also be snoring. Even snoring is considered a sign of overdose if they've used opioids. To administer the Narcan, all you will do is you'll peel this back, remove it from its packaging, take your index and your middle finger, place them here, your thumb on the plunger. When you go to administer the drug, take your other hand, tilt the person's head back, stick this into the nostril until your fingers touch their nose. That's how you know it's deep enough. Once you're in, just press on the plunger. Once you do that, the person could wake and they may not wake. If they don't wake, you can administer this every 2 to 3 minutes, alternating nostrils each time, until they either wake or emergency medical services arrive. And that's the most important thing. If you encounter someone experiencing an overdose, make sure and call 911. There are good Samaritan laws in place. If you were a part of, this person's overdose, if you took them the drugs, if you were partying with them, doesn't matter. If you're trying to save their life, there are good Samaritan laws that will protect you because you're trying to save their life. If they do wake, they can experience withdrawal symptoms. These symptoms can range from simple sweating, chills, goosebumps, things like that, to severe body aches, abdominal pain. They can vomit. They can defecate, because it puts them into immediate withdrawal. That's what this drug is designed to do. So they could also be very agitated, but it's very important that you stay with this person as long as you feel safe. If you don't feel safe, I understand you have to leave, but if you feel safe, stay with that person until paramedics arrive and you can give them all the information that they need. I know this conversation is not very interesting. I know that it's not a fun one to have. But being educated in the administration of this medication may save someone's life, and it may save your own. We've come a long way in medical treatment for drug overdoses, especially when it pertains to opioids. And we now have a readily available drug to give people a second chance at life, and that's truly amazing. I know it's divisive. People think we should just let drug addicts die because they're making their own choices, right? That's what a lot of people think. However, someone cared enough about me at one point to think I deserved a second chance. And I've spent the last 13 years of my life trying to repay a debt that I can never pay in full. So I try to make sure that I do things as honestly as I possibly can when it comes to educating people in the potential life-saving effects of this drug. It's very, very important. I hope this was informative. You can contact me with any questions you may still have. If you need to find some, I can try and help you locate a place where you can get it for free. Again, this was Dakota Williams. Have a great day, guys.